Dark clouds hung over St. Augustine's Hospital as Nurse Sophia Jackson clocked in for her shift. She had no idea that today would change everything. Known for her kind heart, intelligence, and steady hands, Sophia had become a favorite among patients and staff alike. But there was one person who didn't appreciate her skills: Dr. Bradley Walker. Dr. Walker was new to the hospital, but he had already made a name for himself as the most arrogant surgeon on the floor. He was brilliant, yes, but he had an ego to match. He viewed nurses as little more than assistants there to follow his every command. To him, they were beneath him, and he didn't hesitate to show it. The day's trouble started with the arrival of a new patient, Mr. Henry Jameson. Mr. Jameson looked like an ordinary man, quiet, older, with silver hair and a sharp, attentive gaze. He was there for a heart procedure, and the staff treated him with standard protocol. But what they didn't know was that Mr. Jameson was far from ordinary. Mr. Jameson was a retired CEO of one of the largest hospital networks in the country. He had spent decades building healthcare systems, advocating for frontline workers, and ensuring that every hospital under his leadership was a place of respect and dignity. Now, in his 70s, he knew the inner workings of hospitals better than anyone else, and his presence would test the hospital staff in ways they couldn't imagine. Sophia walked into Mr. Jameson's room with her usual warm smile, greeting him as she checked his vitals and prepped him for his procedure. Her calm voice and gentle touch immediately put him at ease. They chatted for a moment, and Sophia's genuine compassion shone through. Just then, Dr. Walker barged into the room, barely glancing at Sophia. He looked only at the chart and began speaking in a clipped tone. "Nurse, are you sure you've done everything correctly? This patient needs precise care, and I don't want any mistakes." Sophia nodded, but Dr. Walker didn't even look up. His voice grew louder, sharper. "Follow my instructions carefully, nurse. I can't afford any errors." The tone he used wasn't just dismissive, it was humiliating. Mr. Jameson's eyes narrowed as he observed the doctor's tone. He noticed the tension in Sophia's face as she held herself together, responding calmly, even as Dr. Walker's words grew harsher. Mr. Jameson had seen many things in his career, but witnessing a healthcare professional disrespecting a nurse in front of a patient? That was crossing a line he couldn't ignore. Mr. Jameson cleared his throat. "Excuse me, doctor," he said, his tone steady and commanding. "Could I have a word with Nurse Sophia? Privately." Dr. Walker looked taken aback. Of course," he said, a hint of irritation flashing across his face. He left the room reluctantly, casting Sophia a sharp glance as he went. Once they were alone, Mr. Jameson turned to Sophia with a look of compassion. "How often does he talk to you like that?" he asked gently. Sophia sighed, the weight of her exhaustion showing. "More often than he should," she admitted. "But we're used to it from him." Mr. Jameson's face darkened. "Used to it? I spend my life building hospitals, making sure that people like you are treated with the respect you deserve. You're not just a nurse. You're the heartbeat of this hospital." He took a deep breath, as if steeling himself. "Would you mind if I spoke to someone about this?" Sophia hesitated, but could see the determination in his eyes. She finally nodded. "If you think it will help, then, yes. Thank you." Minutes later, the hospital administrator and 2 senior board members rushed to Mr. Jameson's room, their expressions anxious. They knew exactly who Mr. Jameson was, and that he wielded considerable influence. Dr. Walker, realizing something was happening, slipped into the room as well, clearly uncomfortable. He was completely unprepared for what came next. Mr. Jameson didn't waste any time. "I witnessed something unacceptable in this hospital today," he began, his voice low but powerful. "Your Dr. Walker showed a shocking level of disrespect to Nurse Sophia right in front of me." Dr. Walker, pale as Mr. Jameson, continued. "I built my career on the belief that respect is the cornerstone of good healthcare. Nurses like Sophia are not your assistants, they are your partners in care. Without them, hospitals fall apart." The administrators glanced nervously at each other, realizing the gravity of the situation. "Mr. Jameson, we apologize deeply. We'll address this issue immediately." But Mr. Jameson wasn't finished. "Dr. Walker, I don't know where you learn your manners, but it wasn't in any hospital I want to be a part of. If you want to lead in healthcare, the first lesson is respect. If this is the way you treat your team, then I'm transferring my care elsewhere, and I'll make sure the board knows why." Dr. Walker, clearly shaken, stammered, I didn't mean. I apologize if my tone was." Mr. Jameson held up a hand, stopping him. "Apologies aren't enough. Actions are. You'd better learn that every member of this team deserves respect, or you'll find yourself alone in an operating room with no one willing to support you." From that day on, Dr. Walker's behavior changed. He spoke with a new humility, treating the nurses with the respect they deserved. He knew that his reputation had been saved by Mr. Jameson's intervention, and he couldn't afford to make the same mistake again. Sophia continued her work with quiet dignity, her dedication unwavering. But word of her story spread through the hospital, inspiring every nurse, every assistant, and even the doctors. She had shown them all that respect wasn't just a requirement, it was a right. And as for Mr. Jameson, he left the hospital knowing that, once again, he had made a difference.